I think the patient-doctor interaction is probably the most important thing you can do. Not every doctor is going to be connecting to every single patient, nor vice versa. As long as there's an awareness of different styles, perhaps, so awareness of the concern, of seeing the problem that the parent is bringing in with the patient, to make sure you see it rather than just kind of dismiss it. It's really important to see the problem, to feel the problem, and to make sure that you understand the problem before you try to diagnose or address it with treatment. Those are important things. As I talk to people who want to go into pediatric orthopedics and do what I do, I think the challenge is the multiple relationships, especially with families that can have multiple sets of parents or grandparents or other caregivers that are all very interested, but it makes it very challenging sometimes to address all of their needs and different perspectives from the way they come into things. But to try your best. It may not be perfect, may not solve all the problems and all the concerns, but I think it is to try that. I think the most rewarding thing is when, in scoliosis, for instance, for a young adult to take responsibility and wear the brace without the parents having to hound them all the time. It's a give and take with parents. They'll try to get away with it, but some kids just do great with a brace, and they will wear it and are responsible 16 hours a day, and they can beat scoliosis by preventing it from going up to an operative level of 50 degrees. Sometimes that works, and it's just great, and I always take special energies to congratulate a young adult of dealing with this way, and some of the kids do a great job. And it's right around this time when they're going off to college or seeing the conclusion of their treatment that it's just a wonderful relationship that I enjoy with the family. In the same way, some kids do the brace and the scoliosis progresses anyway, and that can happen. And another rewarding part of it is to navigate the surgical intervention in a safe fashion, and can solve that problem. And over the year that it takes for this fusion to set up, in the same area where I'm seeing them as they go off to college or a job or whatever, to have a successful scoliosis fusion, with or without the bracing, if that was necessary, or they presented too late. That's another satisfying part of my practice. The energies that a doctor brings towards this practice vary throughout their career. When you first get out of fellowship, you're charged up with all the most recent things that were taught to you. But however, I don't think I use hardly any of the surgical skills or techniques that I learned as a fellow. What I'm doing now is totally different. So you have to stay abreast of those things through attending national meetings, reading the journals, and just keeping your energy up on staying with the game, if you will, with the advances that occur. But also not ignoring your own wisdom that comes through 20, 30 years of practice.